You know, I'm a doctor and I want to nerd out for a second because I get like 10,000 emails a day about COVID. So I want to talk to Brandon about running an organization during this time, especially primary care, when like the government has said, kaboot on primary care, do it from home, figure it out, but we're only COVID. Like, how has that like changed, I guess, the strategy of the DC primary care group? Where are they going? Are they picking up their insulin needles? Like, how are y'all caring for these patients that can't even go outside?
Well, good question. So I think in the first week, a lot of the health centers, which are mostly Medicaid, there's a little bit of Medicare dual eligible population, seeing a 50% decrease in their patient volume. And, many of the health centers are really dependent on the patient volume to, generate income. Many of the health centers have a couple of different service lines, the first of which is medical care, and then there is behavioral health and dentistry. And so I think from the behavioral health perspective, that's the arm that I think has been the most successful with transitioning to telemedicine and the quick adoption of telemedicine so that patients can, have those consultations and those therapy sessions via a telemedicine consult. And so that's been able to generate a lot of revenue. I don't want to say a lot of revenue, but it's been able to sustain itself as a business line outside of being having a physical presence, within the bricks and mortar. That being said, dentistry is something that has seen a significant decline almost to zero, particularly because you can't really do dentistry, from the beds, outside of the bedside or, from a telephonic or a telemedicine visit. So from the health center perspective, there's a lot of dentists that are still on staff that the health centers are absorbing the cost for, but there's no revenue coming in. So that's a challenge. And then from a primary care perspective, again, first week, 50% decline. Second week, I think they were able to pick that up around like 20%. And so where we are now is that I think many of the health centers are around like 70% volume, but that's still a 30% decrease. So, I think the good thing is that they've been able to adjust relatively quickly with the transition to telemedicine visits. Many of the health centers are not seeing any patients outside of those who have respiratory, ailments. And so we're encouraging patients to, call their providers, have a conversation about their symptoms before presenting. But many of the health centers are really not seeing any patients unless it's a critical issue outside of anything respiratory. And so a lot of our conversations today has been around how can we take advantage of the 1135 waiver. It's an emergency waiver that the health centers can take advantage of. And what it gives is interim funding so that the health centers won't lose a big bucket of revenue. We don't know when the extension lasts for several months. It's like a 90-day extension, but the idea is that it will probably last to the end of the year because we really don't know when this pandemic will kind of taper off. And part of the challenge is, as you transition patients into, in terms of helping them to manage their chronic conditions from home, it's going to be that much harder to get them to come back into the health center. So that's a challenge. We've also been working with the payers to make sure that we can give patients like access to high glucose monitors and also blood pressure cuffs so they can manage their blood pressure and their diabetes from home. And so I've been doing a lot of patient education, as well as working with the acute care facilities in the district around, ED appropriateness of use, when to show up for the ED. I have lots of patients that are coming to the ED for pregnancy tests and, other things that they should not be coming to the ED for, some of which is still happening in the midst of the pandemic, but for the most part, people are staying home. And so the focus right now is, utilizing telemedicine, but seeing how we can not lose some of our important service lines like dentistry, because I think, if we were to lay off these dentists, it's going to be relatively difficult, if not impossible, to rebuild those service lines, when everything comes back online. So that's what we're trying to focus on now.
Oh, you smart. I guess that's why they made you the COO. You in the C-suite because you smart. That was very technical.
Right.
I'm coming for you, Jonathan. How many people think this virus was man-made? Jonathan, you may not be privy to say since you work in the defense and / governmental contracts, but
say it, Jonathan.
Resistant bugs.
Who else made it? I mean, like,
Kinda. So I'm just saying, this seems to be different from any other pathogen we've ever encountered in the 100 years that we have documented. So, and it's behaving very strangely. So it's a long period of
mute your phones, please, people.
it's a long period before you actually show symptoms, and then most people are asymptomatic, which is efficient spread of the disease. And then if it really hits you, it hits you hard and you're dead within 14 days. I don't know any disease that behaves like that. So what are y'all thinking? Have you pivoted and to find a vaccine, or are you still focused on like the triple resistant Pseudomonas or Acinetobacters?
So, I mean, we focus primarily on those superbugs like the Acinetobacter and the Pseudomonas. We haven't focused, our team hasn't been taxed with the the whole coronavirus. So that's a whole separate section for the research part of our team at Rare. So my folks are still focusing on those, like I said, Acinetobacter and those Pseudomonas superbugs for those servicemen and women, or even from just providing research data back to CDC or other stakeholders, whether it's here in the States or abroad. So fortunately, don't have much detail on how we're supporting the coronavirus, but the part that we're focusing on really is still having to collect those superbugs from those various military hospitals and other stakeholders from here and abroad, and just seeing the impact of the requests for the outbreak data that they're requesting to be sent back as fast, as folks are wanting to get tested for the coronavirus. So it's definitely more pressure from the federal perspective with them having to identify essential staff that are still having to come into the labs and still protect their families and still come into work, but still having to deal with these superbugs or nasty bugs. So it's definitely has caused me as a program manager and other management staff to have to be creative in trying to encourage our staff to still want to come into work and deal with this, even though they deal with superbugs already, which are easily transferable, contagious, can cause issues, health issues. But this is a whole different thing. Like Brian said, this is something we have not experienced before. And even folks that are in the medical field know how to wear PPE, they are still paranoid because this can easily be transferred to their families and their kids. And it's how do you self-isolate from your kids, if something happens. And so that's the part that we're having to be creative on our side, just to ensure that our staff has the appropriate PPE as well as social distancing. And a lot of the labs in these facilities are not that large. So we're having to draw down on our staff to, still get the work done, because government, from their perspective, still mission critical to still save our servicemen and women who are presented with these different bacterias. But then you still have this pandemic going on. So it's been very interesting to see how this plays out. And so we're hoping that, as more details and information comes up about this coronavirus, it'll help us from a defense, Department of Defense perspective, be able to really, provide some more reassurance to the people on the front lines from a military perspective as well. And those folks that are in the hospitals providing care to those folks and having to come to work still. So it's interesting times.
Thank you so much.